The following is a statement made by Deputy Premier and Minister for Health and Social Development, Honourable Carvin Malone, on the ongoing response to COVID-19. And now the Minister.
I extend greetings to everyone, and I thank you for joining us for the update on the ongoing COVID-19 response in the British Virgin Islands. As of April 6, 2020, there are 1,174,866 confirmed cases of COVID-19 globally, with approximately 64,541 deaths. It is important to note that in that number, 3,559 are confirmed in the Caribbean region, with 154 deaths that were reported. 81% of persons infected with COVID-19 remain mild, while 14% are deemed serious and 5% are deemed to be critical conditions. The World Health Organization continues to classify both the global and regional risk of COVID-19 as very high. Today, we are announcing that 17 samples were collected by teams from the RSS, the Regional Security System, and tested by CAFA over the past 2 days. And the good news is that all results were negative from the virus that causes COVID-19. This brings the total number of samples tested to date to 64, 61 negative and 3 positive. All positive cases have exhibited only mild symptoms and did not require hospitalization. All 3 cases are being or will be retested in accordance with CAFA's protocol for determining full recovery from COVID-19. The Ministry of Health is pleased that there is still no sign of person-to-person transmission of the virus in the territory. However, I strongly caution that the risk of transmission has not been eliminated, as the disease can spread silently for some time before being detected. The COVID-19 war is far from over. Our teams continue to expand surveillance and testing, provide support to all persons in quarantine, and strictly monitor for development of signs and symptoms of the disease to ensure appropriate isolation, management, and or treatment as necessary. Anyone experiencing a fever with cough or difficulty breathing is encouraged to contact the health hotline at 852-7650 for medical assessment and guidance. Our mission is to find and isolate any remaining cases of COVID-19 in the territory in order to minimize the risk of community spread and the suffering and loss that this would bring. As difficult as it is, this is why it is so important to have a 24 hours curfew in place at this time. Do your part. Fisher persons and farmers can secure their boats and attend their farms and livestock beginning between the hours of 6 a.m. and 12 p.m. Persons deemed as essential workers are issued passes to travel to and from work on duty only. Passes that are issued are for the purposes only. For the purposes issued only. All other activities are deemed violations. If you have not been issued a pass, stay home. I once again strongly encourage everyone to strictly adhere to the letter and spirit of the curfew order and stay at home for the entire curfew period as recommended by public health experts. By doing this, you are saving lives. For emergency workers and other essential and critical services that require persons to venture out of their homes for work-related activities, I remind you to adhere to distancing, hygiene, and sanitation guidelines in order to minimize your risk of exposure to the virus. And I thank you sincerely for your sacrificial service to our territory. We observe with deep concern that the rates of infection are steadily increasing in neighboring jurisdictions and in countries that have close ties with the British Virgin Islands. The government continues to push ahead with strengthening the capacity of our port, public health, law enforcement, and healthcare delivery system in order to rapidly detect, contain, and manage any cases that might be brought to our shores when our borders eventually reopen. In the meantime, we must continue to be careful to carefully manage the closure of all ports while facilitating the movement of freight and cargo vessels. We continue to secure our borders to curtail illegal entry, update our risk classifications of countries, territories, and areas of special interest and high risk based on WHO's situation reports and other public health data. Entry to the BVI would continue to be prohibited based on travel history to or from high-risk areas within a period of 14 days and will maintain physical distance between people and avoid gathering in large groups. To some, these measures may seem like an extreme response when the territory still has only 3 confirmed cases of the virus. Those of us tasked with steering the territory through this unprecedented storm have agreed that it is vitally important to take all possible precautions when it comes to protecting our people. We only have one chance to get this right. All the measures taken so far are in line with one main objective: to prevent and limit the spread of COVID-19 in the British Virgin Islands. In addition to the travel restrictions and social distancing measures mentioned before, we have invested heavily in medical equipment, supplies, and the public health facility in order to be prepared to safely and effectively manage and treat COVID-19 patients. In this regard, I wish to place on record our deep appreciation for the contributions received and pledged from Public Health England, the Bank of Asia, Unite BVI, the Rotary and Lion Club's family, and other donors. With the approval of the United Kingdom government, we have arranged for the deployment of essential medical personnel from Cuba to the British Virgin Islands under an initiative being spearheaded by the OECS Commission. We have also expanded social services to ease the burden on vulnerable households, such as home deliveries of grocery and essential supplies, distribution of vouchers and care packages, feeding programs, and psychosocial support through various hotlines with professionals poised to respond to reports of child abuse and other forms of domestic violence. We are grateful to the hard-working teams at the Social Development Department and the BVI Red Cross for their leadership in delivering and coordinating these services. I also recognize the many non-government organizations and volunteers on Tortola and the sister islands that have mobilized to bring support and relief to the communities during this challenging time. Roadside collections of waste has been rolled out to all communities. Residents are directed to put out their household waste in sealed bags between 6 a.m. and 7 a.m. on Mondays, Wednesdays, and Fridays. During this period of curfew, the government has found no better time to implement or roll out the 7 R's of our waste management strategy: reform, restrict, reduce, recycle, reuse, rethink, and return. Details of our strategy will be disseminated, and all stakeholders will be invited to participate and contribute to their areas of expertise. In the meanwhile, we invite you to clean plastic bottles, glass bottles, and aluminum cans, and these should be stored at home and recycled after the curfew. I will announce a village competition for students, and the households, or maybe the village, that collects the most recyclable items would be awarded laptop computers or other prizes to enhance their learning experience. The ministry will also use this opportunity to advance the introduction of its Complete Health Improvement Program, CHIP. Together with the Ministry of Agriculture, the Ministry of Education, and the Ministry of Natural Resources, we will collaborate and implement a holistic approach to healthy living. I am assured that no medication or vaccines can substitute for proper diet, proper exercise, proper rest, and proper state of mind. The Ministry of Health and Social Development and the entire government of the Virgin Islands will continue to exert our best efforts based on scientific evidence and best practices to put effective policy measures in place to safeguard the health and well-being of our people. I urge everyone to continue to do your part to protect yourselves and your families by adhering to all legal requirements and public health guidelines. We will continue to keep you informed, and I invite you to keep aware of the latest advice and information with updates and government website, bvi.gov.vg/COVID, COVID-19. Thank you, and may God continue to protect and bless these Virgin Islands.
The preceding was a statement made by Deputy Premier and Minister for Health and Social Development, Honourable Carvin Malone, on the ongoing response to COVID-19.